And we are appealing to anybody who is holding oxygen cylinders to immediately return them so that the companies can be able to use them to supply oxygen to our hospitals.
Mieri ino ya minista wa ugima wa mwiri Mutahiwa Kagwe tariki 30 mweri wa gatatu mwaka muhituku niriyonanirie unyihu uria uri kuo wa riera ria oxygen guku bururi-ini riria riabataranagia kuri arwaru a murimu wa COVID-19. Na haha agiatha iganda ithathatu njeru cia riera ria oxygen guthondekwo na iria ciathukite gukirio niguo kunina unyihu wa riera ria oxygen bururi-ini. Hau kabere murwaru ahuthagira mutungi wa riera ria oxygen ari wiki no thutha wa kihuhukanio kiria giakorire bururi mathibitari no muhaka mangiarutire maguru ngunia na njira ya guthundura uria mutungi umwe ungihuthirwo ni arwaru aingi na njira ya riera gutwarwo kuri arwaru kuhuthira miberethi.
COVID to some degree has contributed to improvement of services, health services across this country. Many facilities have made big improvements. One of the big areas has been in the supply and delivery of oxygen. Something I need to do maintenance.
Mbere ya wagi wa riera ria oxygen guku bururi-ini mathibitari maingi matiahuthagira njira ya gutwara riera kuri arwaru na baibu no kuringana na ndagitari Victor Ng'ani kuma thibitari-ini wa Ruai Family Hospital ni atuthathaurire mawega ma kuhuthira njira ya baibu gutwara riera kuri arwaru.
It makes it easier for you to regulate, and if you use advanced systems, then actually you have sort of a circuit check. There's a whole system that looks at your oxygen supply. If the pressure goes down, it alarms and able to change that effectively.
Hihi ni morito mariko maumanaga na kuhuthira mitungi ya riera ria oxygen?
The challenge with using portable oxygen cylinders is, number one, the regulation is quite different. There has to be somebody there with you looking at the oxygen gauge to make sure it's not running out.
Ng'ani ni augite ona thenge ya thibitari kuyukia uhuthiri wa baibu mitungi ya riera ria oxygen no muhaka ikorwo iri mathibitari-ini.
Definitely need the cylinders. So if you go to an ICU and you cannot see cylinders, there's a problem there because you need a backup system. So you need to have oxygen cylinders on standby for any emergency and also for transporting patients.
Kaunti-ini ya Kiambu ni imwe ya kaunti iria yagacirithirie riera ria oxygen kuria kuri na mashini 4 cia uthondeki wa riera ria oxygen thibitari-ini ithatu cia level 5 na thibitari-ini ya Tigoni iria iri na uhoti wa kuiga riera tani 3 riria rihuthagirwo o thutha wa mathaa 48 arwaru a COVID-19 mwaka muhituku kaunti-ini ino matiarihagio kuhuthira riera riri. Mbere ya king'uki gia COVID-19 riera rita milioni 3 nicio ciahuthagirwo o muthenya no hindi iria murimu wehiririe guku bururi-ini o muthenya kurahuthagirwo rita 31 guku bururi ukihota kuongerera iganda cia guthondeka riera ria oxygen nginyagia iganda makiria ma 70.
Miaka iri mihituku tungiakora mitungi ino iri wadi-ini na ICU cia arwaru no kuhitukira uthunduri uria umanite na murimu wa COVID-19. Riu riera ria oxygen riratwarwo kuri arwaru kuhitukira mibaibu iria nio njira iria njagiriru na yendekithitio ni ruhonge rwa WHO. Ngiribotera Kameme TV de thibitari-ini ya Ruai kaunti-ini ya Nairobi. Ritu rakwa ni Wanjiru wa Foro.